Hey everybody, thanks for being here today. I see new names, that's really exciting. Appreciate it. Are you able to hear me? Yeah, great. Okay, I'm going to begin our meeting today by acknowledging that we gather on the ancestral homelands of the Coast Salish peoples who've lived in the Salish Sea Basin throughout the San Juan Islands and the North Cascades watershed from time immemorial. Please join me in expressing our deepest respect and gratitude for our Indigenous neighbors, the Lummi Nation and Nooksack tribe, for their enduring care and protection of our shared lands and waterways. My name is Terry Bryant. I'm the director of the Homeless Service Center Department and Opportunity Council, and I'm the chair of this group. It would be great if you could introduce yourselves in the chat, and if you'd like to get included on our mailing list for future agendas and advocacy opportunities, that would be great too. We're recording this meeting. I see so many new faces that I think I'd like to start by kind of just framing what this group is and what we use this time doing. This coalition has been meeting since 2008, and I think I am the fourth chair, and I'm pretty new. I've been doing this about a year. Before me was Mike Parker. I think I saw him as Executive Director at Opportunity Council. This meeting is open to the public, anyone who has concern and interest about serving homeless folks. And this is a forum where we can discuss issues related to homelessness, share advocacy opportunities for the needs of people who are experiencing homelessness. We can plan with the city and county governments on the strategic plan to end homelessness, and that duty primarily falls in the steering committee, which also sets the agendas for these meetings. This is not an advisory board per se to inform local government, although recommendations can be made and are appreciated. This is a group of community members and service providers that are all just concerned with homelessness, and it's a very collaborative community. Participating here is a great way to meet other people who are working on the same problem and identify ways that we can work together. About this time last year, we did a poll during our Zoom meeting, which is, I guess, the way we do things now. And the vast majority of folks really indicated they wanted to use this time to learn what other people are doing in their programs and agencies. So that's what we've been doing. Today we have a few presentations. The first presentation is kind of an announcement, and that's from Peter at Northwest Youth Services has some exciting news. Peter, do you want to go ahead and jump in?
Yeah, thanks, Terry. The exciting news is Northwest Youth Services has a street outreach program again. Yay!
Yay!
Yeah, nice. Yeah, so after being a couple years without, Northwest Youth Services has started up our street outreach program. We've been fully staffed since about mid-April. So it is me, I am Dan Peter Maturko, I'm the street outreach program coordinator. Before stepping into this role, I was a housing case manager for a couple of years, 2.5 years at 22 North. With Northwest Youth Services, our program is composed of myself, our street outreach specialists, Beth and Katarina. Some of you may know Kata. She's been on and off with our agency for a few years. We're very lucky to have her back, especially with this program, so we get it up and running again. I'll drop a flyer in the chat, Terry, if that's cool.
Great.
Okay, I'll do that in a second here. Just some of the broad outline stuff. We're doing outreach 5 days a week. Right now we're scheduled for 8 routes a week. The majority of which are centered around where we see folks, which is downtown Bellingham area. We have our own vehicles, so we try to get out Greater Bellingham as it seems appropriate, where we think that we've heard from other providers or other folks where we may find some youth to connect with. As some of us know, youth homelessness looks a little bit different than homelessness older folks experiencing homelessness. And thankfully, you know, a lot of the chronically homeless youth we've worked with previously are now housed at 22 North. So we're trying to really surface housing insecurity, youth that are at risk to homelessness, youth that are street dependent, and really connect them with our services or what would be great services for them for housing, whether it's within our program, with other programs. So we're doing outreach 5 days a week, about 8 routes right now. We're trying to get out to county 1 day a week. As that looks, we're trying to really be flexible as to how we can be helpful or useful for our county neighbors and partners. So, for example, that could be like a county-based coalition meeting right now. It could be actually getting out to a library or a particular event. Yeah, those are sort of the broad parameters. Street outreach is the street-facing arm of Northwest Youth Services. We also have the ground floor, which is a youth center. We are, surprisingly enough, different programs funded by different resources, but we collaborate very closely. So we're always, one of our first steps with folks is to really get them acquainted to the ground floor, because we have a lot of our services based out of the ground floor right now. And thankfully, one of our staff, Beth, is also working part-time at the ground floor. So it's a great way to have that continued care, that friendly face out the street at our day use center. That's all I can think of right now. Does anybody have any questions for me? I'll send the flyer along this chat.
Thanks, Peter. And I'm wondering, I'm getting some messages that the chat's not accessible for some folks. Is anyone else experiencing that? Marisa, can you look into that? I see that we're having chats in there, so I don't know what's going on. Everyone publicly and privately is set.
Yep, and all participants should be able to share screen, chat, rename themselves, or unmute themselves. Everything's good on my end.
I'm going to give you my email if you still want to make sure you get on the distribution list and you're not able to chat. Email me please at TERI_BRYANT@whatcomhsc.org. And I'll try to put that in the chat and see if you can see it there too. Sorry for that glitch. Okay, next item on our agenda are some presentations. We have some special guests from 2 different projects. One is the Way Station that you may have already seen in the newspaper. And that's a project slated for State Street. And that's a partnership between Peace Health, Unitycare Northwest, Opportunity Council, and I hope I'm not missing anyone else. We'll have Marisa McGrath. She's the Communications and Public Relations Associate at Unitycare Northwest. And Nicole Fields is a Health Manager with Unitycare Northwest. So they're here to describe that project, and we'll have some Q&A right after that. Then the second project, or second guest, I should say, that are joining us are Shannon Edgel, who's the Marketing Supervisor with Lifeline Connections, and Adrian Solenberger, Housing Developer for Opportunity Council. And they're going to speak to the Way Station, excuse me, not the Way Station, the Recovery House project. So I think if we're ready, Marisa and Nicole, did you want to go ahead and start?
Sure, absolutely. And I'm going to
Thanks for being here.
Oh yeah, thanks so much for having us. It's so nice to see so many faces doing this important work and taking time and making space in their day for this. And so I really appreciate everyone for having us. I'm going to try to do the most graceful version of sharing my screen that I can with our little presentation that we have here. So it's just going to take me a couple clicks. And I I think that should work. So does everyone see the slides? I can tell by nods. Okay, great. Wonderful. Thanks. As we said, I am, or as Terry said, I'm Marisa McGrath, and I am the Communications and Public Relations Associate at Unitycare Northwest. I'm relatively new, and I've been working with our Planning and Development Director, Chris Kobdish, on this project, the Waste Station, that we just recently sort of announced. And then I'm gonna have Nicole introduce herself as well.
Hi there, thanks so much for having us. My name is Nicole Fields. I'm the Population Health Manager here for Unitycare Northwest. And Population Health here at Unitycare is our patient engagement team, outreach and enrollment, quality improvement, and then our health promotion and dietitian services.
So it's all the fun stuff, I think. Okay, so just some basic information about Waste Station. So Waste Station is a safe and welcoming facility, or will be, where individuals and families experiencing homelessness can find a constellation of services to assist their transition to sustainable housing and access to social health services. We're going to unpack all that for you here. So, and we will have some time for questions at the end. So we aren't aware of a model like this anywhere else. It'll have 18 beds segregated by gender, and we will provide medical and behavioral health access, dental and substance abuse treatment at Unitycare Northwest, which is just around the corner from the location, which is at 15. We'll talk a little bit more about the location a little bit later. We'll have hygiene facilities, including restrooms, laundry, showers. There'll be a small landscaped outdoor space in the back parking lot as well. Okay. And Nicole, you can tell me next slide whenever you need a next slide.
Perfect, thank you. So I want to get started by taking a look at our data. Now this is a lot of information on a slide. So the most simple way to look at this is the 3 columns going down with the numbers in them are our Unitycare Northwest housed population. The middle column is our unhoused or people experiencing homelessness population. And that third column all the way on the right is a comparison for all of Washington's community health centers. And what data we're looking at here is medical diagnoses per 1,000 medical patients, which basically is a way of looking at how sick our population is in the simplest of terms, right? And we can see in this middle column here, our unhoused folks are doing much worse. They have much worse health outcomes than a lot of our people that are in steady housing, which likely isn't a surprise. But to me, I think it's really worth looking at all of the chronic diseases that are really worsened by a person's housing status. And we know that they're limited access to care, limited, availability of supplies to care for themselves when they go to where they're staying. And so a lot of these things that we see here are exponentially worse. Like if we look at COPD, that's twice the amount of people are suffering with COPD than our housed populations. And when we think about how many people that is in our health center, about 15% of our patients are homeless. This is self-reported, which is about 4,000 self-reported individuals, which is defined by us as people that are couch surfing, staying with friends, housing insecure, or kind of the traditional definition of, sleeping on the streets or sleeping in shelters. And it's all self-reported. The data demonstrates that we're just seeing much worse health outcomes in our homeless population than our general housed population. And so we really wanted to think about a way that we could deliver care to meet those needs. And for the Washington CHCs, that is a state average. So all of the federally qualified health centers in Washington are in this CHC column here. This does not differentiate between housed and unhoused. This is the general population for all of the community health centers in Washington. So an interesting trend between our Washington CHCs and our housed population at Unitycare Northwest is you can see that we're already looking at a higher need population than the state average. And then when you compound that with people that are experiencing homelessness, it just makes the health outcomes all that more drastic. You can hit the next slide, please. So the Homeless Strategies Work Group that was in effect in 2018 ranked the urban rest stop or away station as a top responded need. So this was one of the top needs that came out of this group. And other recommendations that came out of that group include case management across the spectrum and a small specialized shelter for specific populations. And the way station really looks at combining these things in a thoughtful way. The way station is not going to be something that's permanent housing, but it is a stepping stone along the way that is safe, that is clean, and is going to help people have better engagement with their healthcare. And when we think about how this fits into the mission and the work that we do here at Unitycare, we're able to be a strong partner and collaborator to the project in the form of whole person healthcare. And next slide, please. So what is whole person healthcare? And what does that mean for a person that's experiencing homelessness? And we talked about this a little bit in one of the previous slides, but these are kind of all of the things that go into making sure that a person is able to take the best care of themselves possible, right? And engage in their healthcare. So if we think about someone who perhaps has diabetes, right? And if they're housed, they have access to a refrigerator where they can store their insulin. They likely have transportation to the clinic. They can maybe take paid sick time from work. And if we start thinking about someone who's unhoused, they might not have a bed to sleep in, much less a refrigerator to store their insulin in. And so that's where we really want to take into account the whole person and their needs to make healthcare as accessible as possible. So Unitycare, we're a local nonprofit healthcare provider, and we're part of a national network of community health centers, which are called federally qualified health centers. We have over 20,000 patients, mostly in Whatcom County, and we have 2 different health centers. One's downtown, and then the other is in Ferndale. And we've seen this pop up a lot where people who maybe are needing primary care services or have other barriers to care are using the emergency department instead of coming into the clinic for primary care, right? So if they perhaps have a wound that they're not able to keep clean because of their living situation, they don't really have a lot of options right now. The ED is kind of the best option for a place where they can stay and get care and keep that wound clean. And I think the way station is really filling a need for those folks that need those transitional services. Another thing that's come up quite frequently for us is people that are preparing for a colonoscopy and don't have a place to stay. And I don't know that if you have ever prepared for a colonoscopy, but you get a delicious cocktail that makes you very prepared for a colonoscopy in the morning. And I cannot imagine having to prepare for that and not be housed. So you think about, I mean, those fundamental needs of having access to a bathroom, having access to a shower. And so those are the things that aren't necessarily, we don't necessarily need these people seen in the emergency department, but they need a place to go that's going to make sense for them to engage in their health care. We also see some folks that have chronic reoccurring skin infections due to bed bugs and body lice, which inspired the hygiene piece of this. So, you know, it's just one of those things where people are faced with the choice of getting rid of their belongings or living with belongings that are covered in bed bugs. And we want to offer a better choice than that. And we want to offer assistance in making sure that people can keep their belongings, which is just, I mean, it's so important to feeling secure and feeling safe enough to engage in your healthcare. The pandemic really put even more of a spotlight on the medical needs of our most vulnerable residents, because we had our emergency departments filling up with COVID-19 patients, and there was less room for these non-emergent cases. But the question remains, where do these people go? And so that is where the way station comes in. Next slide, please. And these are the services that we plan to provide at the way station as a whole, way station as a whole. So Unity will be providing some of these, and then some with our other partners, including the Opportunity Council and Peace Health. So there would be a recuperative respite care staffed 24/7. As Marisa mentioned, that would be divided by gender as well. It's a safe place to stay and a safe place to prepare for those healthcare needs like the colonoscopy or wound care, potentially IV antibiotics. and make sure that those that our unhoused population does not feel like their only choice is the emergency department. We want to offer healthcare services, including medical, behavioral health, and substance use care with lab testing, vaccines, and health monitoring. So that's a lot of our bare bones primary care services. Let's get these people access to a doctor. Let's let them have those preventative screenings and vaccines in a place that is convenient and accessible. We also want to offer hygiene services, so restrooms, showers, laundry facilities, and a hot room to eradicate body bugs found in belongings. So this is where it comes down to those quality of life pieces. And then, of course, case management services. So we want to link people to social and health service resources and connections to stable housing. So these are those everyday supplements. So what can we provide for you, and what services can we connect you to that will make you more able to engage in your healthcare, to take care of yourself, and to live your healthiest life? We also want to look at potential for other co-located public health services, such as needle exchange, reproductive health services, and IV antibiotic therapies. And I'm going to throw it over to Marisa now.
I'm going to talk about our partners in all this, because yes, we are not doing this alone. Opportunity Council is a wonderful partner and plans to co-locate support services and might have a possible developer role. Peace Health is providing the funding for the respite care piece of this, and will likely contract to provide those services or provide them directly. And then the Whatcom Health Department and Whatcom County in general, the building that we're going to show you in just a second, a rendering of, is owned by Whatcom County and currently houses a needle exchange there. And project thought leader on it, and is providing us with the building. And the health department is discussing, like we said, possibly co-locating other complementary services, because we have a second floor for office space that we could really be very strategic about how we could locate other services there that make this an even, sets us up for even more success in helping people on their journey into finding housing. We had huge support from Washington State Representative Sharon Shoemake and Alicia Rule. This image is from when our North Whatcom Health Center opened about a year and a half ago. And so you can see Sharon Shoemake is the representative over here to the right who attended that event. But we also, the new this year, Alicia Rule, State Representative, they both advocated for $4 million worth of funding for a capital campaign from the state budget, which was the largest capital campaign contribution from the state budget that was included in the state budget this year. There's a lot of real political will to try to make this happen, which we're really grateful for. And U.S. Representative Rick Larson is also has submitted a request for $2 million in capital funding from the congressionally directed spending program, which would mean we would be completely done fundraising for the actual capital piece of this program. It would be great. We could just, but we've already started work regardless. This is where the location is. You kind of might vaguely go, I think I've seen that before, or you might know it more. It might be more familiar to you. It's at 1500 North State Street, and it's really an ideal location. County-owned building, so great partners there, but it's got good square footage for the amount of space that we need. It's got the right zoning. It's really close to other social services and health services, including Opportunity Council and any kind of medical services that we'd be providing at Unitycare Northwest for patients. It's got access to transportation services, all the good things about being located downtown. And there's, like I talked about, that option for complementary programs on the second floor. We have an MOA that we've filled out, that we've signed with the county for a 35-year lease. So that's good. That's a good amount of time to be planning to move forward. And the goals of the way station are pretty simple. We want visitors to the way station to be able to leave healthier and closer to being able to find a home. And we want to disrupt this revolving door cycle of emergency department visits that we're seeing in a lot of the people that we serve. and people that we have not yet been able to serve because we just haven't been able to access, they haven't been able to access primary care. So we really want to make those changes. And this is, again, this is a piece in the myriad, complicated, puzzle that affects how homelessness persists in our community. And it's what we felt like we could do well within our purview. So our next steps are finalizing partner agreements, including ongoing operational plans. We're doing neighborhood outreach now. The Downtown Bellingham Partnership and the York neighborhood need to be informed. We have our permits to file, and there's a waiting period after that. We're going to be doing continued fundraising for both capital, like we're doing with Rick Larson, but also operational. We need to do some operational fundraising, which we'll be doing mostly locally. And we need to finalize our architectural plans and begin renovation. So our goal is to open in 2022, beginning renovations later this year. I've also included a website here, and when I'm done yammering, I'll put the website in the chat as well so that you can see that. If you're interested in supporting the campaign, you can share about it. This is a link directly for people to be able to make contributions to make it happen. Both the city and the county are really motivated and to make this happen. So we're hoping that our permit process can go pretty smoothly. The neighborhoods actually have seemed pretty supportive so far. So that's really great to see. There seems to be a real understanding of the value of a project like this. And we're amending, like the memorandum of agreement. There's some boring kind of back end stuff that we're doing. But anyone who wants to help with our local fundraising efforts can share that website. And if you have any questions, this is our contact information. So if there's anything that you think of later, but obviously we are happy to take questions now as well.
Thanks so much. I really appreciate it.
Yeah.
I see a question from Adrian in the chat.
I am not.
Okay,
Well,
I will read it to you.
Thank you.
It's been mentioned more than once that the way station services will be gender segregated. I'm wondering if this will be inclusive and affirming for homeless individuals that identify as transgender and non-binary, and is there or will there be a plan for addressing those needs for an already vulnerable special population? That crossed my mind too.
Mm-hmm. Yeah, Nicole, do you want to speak to that? Or
yeah, that's an excellent question, and honestly, it crossed my mind too when I was saying it. And I believe we're kind of still in the planning stages. So I think that this is an important question, an important discussion to have now before we're too far down the road. And I completely agree that this needs to be it needs to be a priority for the way station. And so I can follow up and make sure that this is kind of already on our radar, which I have a feeling it is, but I will certainly follow up on this as well.
Yeah, and in general, we as an organization take gender identity really seriously, and we strive to have an affirming environment when it comes to gender. So I would imagine that would be part of the model as well, is to just do whatever is most affirming to the visitors.
Thank you. Joe Gibson has a question. What will be the number of people served at any given time, and what are the specific populations to serve?
So the number of people who could be in respite is capped out at 18 at any given time, but obviously it could cycle. We have people staying for one night or a couple nights. We have the capacity of serving close to, I think the estimate is around 4,000 people a year, or individual visits a year. And then the second part of that question?
What are the specific populations?
Yeah. Nicole, do you want to speak more to population, or do you want me to?
Yeah, so I think the specific population is really anyone that is experiencing homelessness. I don't think that we need to, or we want to put limits on that further than individuals that are experiencing homelessness. I know that that homelessness affects some of our minority populations even in a more severe way than some of our other populations. And so there could generally be some targeted outreach, but I don't know that we want to limit it down further than folks that are experiencing homelessness.
Another question from Charla. What optional complementary programs will be offered?
In addition to the, sorry.
Yeah, could we get some clarification from Charla perhaps on that? Because I'm not sure I understand the question fully either.
Well, while she's adding her clarification to the chat, I think I want to ask about maybe drop-in services, things that are not necessarily restricted to people staying in the respite care or patients of Unitycare or Peace Health.
Yeah. So in addition to the 18 beds, that's a really great point. The hygiene services are available to anyone. Anyone can come and use the restroom. Anyone can come and use a laundry facility or take a shower that needs to. So that has the potential of serving a great deal many more people. Obviously, within reason and when it comes to space. So we are planning to have as many washer and dryers as we can, and then have like a waiting area where people can hang out while they're waiting for their clothes to dry and things like that as well. So
I think that's also, sorry, Marisa.
No, yeah.
I think that's also where our case management and our community health worker staff would come in really, really critically. Is, when someone's waiting for their clothes to dry, how great would it be if they could just chat with someone who might be able to connect them with some other services or perhaps link them in with the healthcare system. And so we do plan to co-locate some of our community health workers or case managers in the way station to just provide that service for folks that are either on respite or they're using respite, or if they're just dropping in for the day.
And this is in addition to the housing case management that would exist with opportunity councils involved in as well.
Yeah, great.
Thanks. Indy has a question. Will people require a referral in order to stay and participate in respite services?
We will be taking referrals mostly from Peace Health. And there's some discussion about, who and where else a referral can come from. I don't think there's going to be turning away, but I think there's kind of the interest is keeping it relatively streamlined, so that we're especially when we're talking about specifically those medical beds, or that medical respite. So we're expecting it to mostly come through Peace Health, but we're open and considering other options for local healthcare providers to do referrals.
Thank you. Charlotte has another question. How would folks be able to use the facilities and services not being able to carry their belongings? It was in the presentation.
No, they can definitely store and have their belongings there. We are going to have we have the hot rooms that people can use to heat their belongings, so they can deal with any potential body bug issues that are happening there, but they can bring their belongings with them.
Chase asks, do you plan to have curfew hours for those who stay in one of the 18 beds? Will people have the opportunity to leave and come back? Or if they leave, will they not be able to enter again? And I don't know that part of the planning is we haven't got there yet.
Yeah, I don't think that we've gotten
Those
to
are
that
valid
level
questions.
of logistics. Yeah, but I do know that it's, you can absolutely leave and come back. It's not like if it's not like sock hop rules where if you come in, you can't leave. And then if you leave, you're gone. So
sock hop was a nicer way to say it than jail, but
yeah. So yeah.
Great. Any other questions? If you want to unmute, you can just ask, or I'm happy to read from the chat. I actually have a question or two here.
Yeah, I can take our little, I'm going to stop sharing so I can see the chat now too. Oh, there we go. That's nice.
One question I have are what kind of services would Peace Health be offering versus Unitycare? Like how are those separated or different from each other?
Yeah, so Peace Health is really going to own the respite part of this. They're really going to be the people who are providing that support, versus Unitycare, who's going to be providing the kind of more ongoing medical support and behavioral health support, those services as well. and also our, like, for example, our community health workers and other staff from our population health department. So, you know, Peace Health is really focused on the people who would be otherwise having a hospital stay, or really it wouldn't make sense for them to be still staying in the hospital. They're kind of focused on this more kind of transitionary respite state that they can support. Nicole, am I missing anything there?
I think that that's a good summary. Yeah.
Mm-hmm.
Thanks. And I just have one last question. Oh, wait a minute. Charlotte has one. How will they be vetted for housing? I don't know that this is a housing project, but certainly staff will be there to engage people in the housing system and make sure that they're connected. I don't know if that helps.
The Opportunity Council are going to have housing case managers available on site, I believe. And so I think that that would be kind of within their scope to figure out how people are screened and how people are assisted into permanent housing.
Yeah. So Terry, is there a current, how does the sausage get made now? Opportunity
That's
Council?
A good question. I haven't been involved in the planning of this, and so I've attended maybe 2 or 3 meetings really briefly, but I have kind of a vision, and I don't know what it's ultimately going to look like. But I see looking a lot like outreach, making sure that people are connected to the resources they need, that they're aware of how to get connected to getting their basic needs met, and making sure that people know how to get connected to the housing system, and even to the point of being able to perform an intake right there on the spot. So that's kind of what I have in mind. Marisa Shepard here, she's the street outreach coordinator, and I think she's going to have a hand in how this gets put together. Do you want to say anything, Marisa?
I think you pretty much nailed it, but I think it's one of those things where we need to see more across the board in order to really nail it down. But I think Terry's on track with it so far.
Thanks. And I have one more question, and thank you for tolerating all my questions. Why this location? Why is this a good place to do it?
Well, it's that, some of it is needing to be in a location where we can have we ourselves don't have to build something from scratch, which is a lot of money, which we'd rather be spending money on getting people access to housing and care instead of a facility. And the county is willing to provide us very cheap rent in order to be at this space, which we're very lucky for, and willing to let us completely, do exactly what we need to do to the space to make it work for our needs and for what we want, what we think is best for the facility. So we're limited by, if we want to work with the county directly on that, we're limited by how much property they own and where it's located. But really having it in a central location where services are already, where people are used to spending time and accessing other services is really helpful. Being close to transportation and being close to organizations where they might already be getting services like Opportunity Council and like our Unitycare clinic, which is walking distance, couple of blocks from this location.
Great, thank you.
Anything else?
Any other questions? I learned that I need to count to 5 before I move on. That's a new skill I have in this Zoom world. Okay, thanks so much for your presentation. Really appreciate your time and expertise.
Yes, thank you so much. And again, please do send us an email if you have any other questions come up, and if we can help in any way.
Great.
Have a great rest of your meeting.
Thank you.
Thank you.
Take care.
Bye.
Okay, shifting gears a little bit, let's talk about the Recovery House, which is a joint project between Opportunity Council and Lifeline Connections. And do we have Shannon and Adrian here?
Shannon's here.
I am here, yep.
Yes, great. Do you guys want to get started? Feel free to share your screen.
Is Kayla here also, Shannon?
Yeah, I saw her name, so.
Okay, perfect.
Yes.
Yeah, I'm here.
Oh, cool. Well, Shannon, did you want to go ahead and jump in and with an introduction of yourself and Lifeline?
Sure. Well, good afternoon. It's great to be here. My name is Shannon. I'm with Lifeline Connections. For those of you who aren't familiar, we'll share a brief PowerPoint, but briefly, we're a community behavioral health organization, and we have a footprint in Whatcom and Skagit County. We also have a footprint in Grays Harbor County and Clark County, with both inpatient and outpatient mental health and substance use treatment programs. Today, we're here to talk about the Recovery House that we're really excited about. So that's just briefly about me, and I'll turn it over to Kayla and let her introduce herself.
Good afternoon. My name is Kayla Rau. I'm the program director for Recovery House. So I will be on site doing the day-to-day programming and making sure everything's running smoothly.
Adrian, do you want to introduce yourself?
Yeah, sorry. And so I'm Adrian Solenberger. I am a housing developer with Opportunity Council. I haven't seen this group of folks for quite a long time, but it's nice to see some of your faces. And yes, Recovery House is sort of nearing its completion. I say that laughingly at the moment because it's had quite a delay. But will be a facility that serves 16 individuals whom are experiencing co-occurring disorders. It's intended to be folks that are 30% AMI and lower, that are primarily being referred through the therapeutic court systems here in Whatcom County. And I think, Shannon, your presentation probably goes through a little more of what that looks like.
Yeah, it does. So I'll go ahead and share my screen at this point. And can you all see that screen? Can you see the Lifeline logo? Yeah?
Yes.
Okay. All right, I see some head nods. Okay. Well, so as I said, Lifeline Connections, we specialize in substance use and mental health. And we are CARF accredited, which is an international accreditation. And who we are, we're about people. So we're a nonprofit, 501c3. We have 12 locations throughout the state of Washington, and we serve about 5,200 people a year. And that includes youth and adults. We have a continuum of care, and I think that's where we differ a little bit from some other community behavioral health. So we can start on the very front end with the outreach into the homeless camps, and throughout our system, folks can go into a detox program. They can go into a crisis program, which is a 3 to 5 day stay. They can go to residential, gender specific, and I want to address that gender specific a little bit from the previous conversation. So we work with folks, however they identify is the program that they go into. And then we also then on the back end provide some housing support, some employment supports, those types of support. So we really try to cover that continuum of care. And then, as I mentioned earlier, we are CARF accredited. And what that matters to this group is that we have committed to establish accountability to our funding sources, referral agencies, and the community to a commitment of quality. This is where, as I mentioned earlier, where our locations are. We have Bellingham and Mount Vernon. We've also expanded out into Concrete and Oak Harbor. We're doing some mat services in those rural communities. And then we're in Aberdeen, and we have a pretty large footprint in Clark County, Washington. So some of the work that we're doing in the North Sound region is listed here. So in Whatcom County, we've got drug court, Pathfinder program, HARPS program. Those two programs are just really getting their footing under them now. We have mental health outpatient, substance use disorder treatment, including MAT, and then the recovery house, which is what we're really here to talk about. And then in Skagit County, we have recently picked up the work for drug and family treatment court and jail assessments and transition. Again, the Pathfinder program and the HEARTS program are in Skagit and MAT services. So those are the types of services that we're offering in both counties, and things continue to grow and expand in the region. I wanted to share this video. It's about a 5-minute video of retired Whatcom County Supreme Court Judge Chuck Snyder. And I'll just let him talk about the recovery house and why that seems to be so important. Are you seeing him on the screen yet? No?
No, still see your PowerPoint.
Okay, let me move that over. Okay, do you see him now?
Yes.
Okay. Thank you for your help.
Hello, I'm Judge Chuck Snyder, recently retired from the Superior Court bench in Whatcom County. I'm really excited to see this recovery house project come to life, and I know that it's going to mean a lot for our community. It's something that has been near and dear to me in my time as a judge, to see how we can help people who are suffering from substance abuse and the concomitant effects of that. I presided over the drug court in the Superior Court for over 12 years. I worked directly and intimately with all of the people who were members of that program, the folks who were the case managers, the participants who were the people working hard to free their lives of their addiction and rebuild their lives. And drug court is a program which is aimed at doing just that, allowing people to completely rebuild their lives. It includes everything from drug treatment and case management to regular court appearances and developing a one-on-one relationship with the judge, which is a very unusual thing in a courtroom. It also we worked very carefully in our case management program to give people the basis for going forward with their lives in meaningful employment or get education, to find a place to live in a way that they could do so in consistent ways with their treatment requirements and their sobriety. And so what we found was very common in our community was it was very difficult for the folks in drug court to have a place to live that was a safe and a clean and sober environment. It was very difficult for them to get away from the people with whom they had generally used. And in many cases, when they didn't have a place to live, the couches they would surf on were those of people with whom they had previously been regular users. And that, of course, is a disaster for someone who's trying to maintain sobriety and to try to build a clean and sober life and another way of living. And one of the things that we struggled with was the fact there weren't many places in Whatcom County for people to live. And I know of many of our participants who would have a difficult time completing the requirements of drug court and staying out of trouble and staying clean and sober when they didn't have a regular place to live. But when they did get a good, solid place to live, when they were able to do so, it made an enormous difference, and it had a huge impact on their ability to do all of the other things they needed to make their program successful. In fact, it had a lot to do with whether they could get a job, because it's difficult to get a job if you don't have an address. It had a lot to do with whether they felt that they had the confidence in themselves to live independently, because you need to be able to do so if you're going to maintain your sobriety. So the housing stability is one of the major portions of ongoing treatment that is necessary for someone to change their lives in the process of drug court or any other addiction treatment program. The problem, of course, is that it's a day-to-day process, and it's something that is part and parcel of treatment. When you think of someone going to drug treatment, you don't always think about all of the other things in their lives. And this part of their life, having a place to live in a safe and stable place, is extraordinarily expensive. And it's also extraordinarily difficult for them to find. So I'm extraordinarily excited that the Rotary Club of Bellingham has chosen to support the Recovery House, to give us the opportunity for people in drug court or other recovery programs to have a place where they can live, to be in a clean and sober environment, to have the support and help that they need. I remember one of our participants in particular, a young woman who had a young child, and when she couldn't find a place to live, she couldn't manage to get to her treatment program. She couldn't figure out how to get to a job and put things together. And she came across a very wonderful person who was able to provide her a place to live, regardless of her history and her background, regardless of what she was doing, who was a person who understood that someone in drug court had a great deal of support built around them and would be a pretty good risk for a place to live. And she gave this young woman an opportunity and a place to live. She gave her an apartment to rent. And it made all the difference in the world. Within a couple of months, she had begun to put her program together in a very solid and complete manner. She and her daughter were living there. Her daughter was back in school. Everything was working out the way it needed to. And it was the first big step for her to move forward to the point where she eventually graduated from the program and went on her own and was able to make her own life. So I can't say enough about how important this program is, how important it is for people to have clean, sober, and stable housing when they're trying to recover from the difficulties of drug addiction. So I'm very happy to lend my support to this, and I'm very happy that the Rotary Club of Bellingham has seen fit to do the same, and that with the help of the Housing Authority and the Opportunity Council, this program will go forward and we'll have good housing for people for many years to come. Thank you.
Okay. Oh, let's see. Excuse me here. All right. So,
wow, look at this.
oh, sorry.
94% of people believe company culture is important.
Sorry about that. Okay. So that brings us into the Recovery House. And just before I turn this over to Kayla, want to speak to a couple of things. Oftentimes, folks think of a recovery house as a halfway house or an Oxford type of situation. And that's not what this recovery house is. It includes a treatment piece that Kayla is going to speak to. And then when Kayla's done, we'll ask Adrian to speak to kind of the partnership that we have with Opportunity Council. This is unique. This is a unique partnership, and we're excited about it. We're excited to be part of kind of a groundbreaking idea in the state of Washington. So with that, I'll turn the time over to Kayla.
Great, thank you. So the Recovery House is a voluntary program. Clients are motivated to move forward, working on improving the quality of life. It's a really good treatment level for individuals who meet the need for drug court because it wraps around all of their services. And they will also be developing job seeking skills and resume building and those types of just daily living skills that they may need some assistance on. So the Recovery House Treatment Program is a therapeutic substance use and mental health treatment. So they are diagnosed with a substance use disorder, and they meet the level of care to qualify for this program. They do not have to have a mental health diagnosis to meet the admissions process, but they do have to have a diagnosed substance use disorder with the appropriate level of care recommended. Individuals in the house will be receiving a minimum of 5 hours of treatment per week. And I say at minimum because every single day is structured with substance use treatment or mental health treatment, but it is a minimum of 5 hours a week. The staff will be mental health counselors, substance use disorder counselors, program director, floor staff, and RAs, and there will be a peer support specialist. So it is a very structured environment. They have a daily schedule that they will be going by, and it will be flexible in the ways that if they have employment or they have court responsibilities, legal responsibilities, things like that, the schedule is flexible to meet their needs. So it's very individualized, but the schedule helps with them and their accountability. They'll have a 10 o'clock curfew. They'll have to have a pass to leave the property. So it is a 24/7 staffed facility, and it is a residential treatment facility. So even if they're going to work or they have to go to the doctor or to court, they will still need to request permission to leave and notify us where they're going, just so, for accountability purposes. And then there also is going to be security cameras throughout, just for everybody's safety. So like Shannon had talked about before, we are a community-based nonprofit organization, and the Recovery House is really there to help integrate these individuals back into the community. So they may be coming from a higher level of care. So they could be in an intensive inpatient program where they were there for 30 days or 45 days, and they need a little bit more assistance stepping down back into life again. And so the Recovery House is a really good step down tool for that, if they need housing and they need job skills and things like that, but also providing stable housing while they're trying to learn these new skills and slowly going back into the community and reintegrating. So when they do leave the Recovery House, they have a solid platform, and they have the support that they need. So that is the general idea of the Recovery House. It is a 16-bed for individuals who identify as men. So does anybody have any questions for us?
Or do we want to have Adrian? Adrian, do you want to present on the partnership?
Yeah, I can speak a little bit to it and we can take some questions. But essentially, Recovery House was a vacant piece of property. I think it was vacant for 10 years. The two buildings previously owned by Peace Health. And so it was a wonderful opportunity to have that be received for development, to create it into Recovery House. I know I'm looking at some of Greg's notes from previous discussions that this project was an inspiration from the Whatcom County's Incarceration Prevention and Reduction Task Force and the drug court program staff. So with the support of the city and support of the state and community members, it was really nice to have it come together so that we can answer some of the immediate community needs that we're all aware of in terms of treating not to the needs of the homeless population, but serving our folks that are experiencing substance use and mental health related crises so they can have an opportunity to reintegrate into the community and access services.
Thank you, Adrian. I think now we're ready for questions. If there's any questions.
Yes, there is one from Dina. Are there any similar existing or upcoming programs for people who are not male?
So currently in Washington State, there's two other similar levels of care facilities, but no co-occurring facilities. And to my knowledge at this time, there isn't anything in the works yet for a female population, although we're hopeful in the future, maybe we could do something like that.
I want to add also that locally Lake Whatcom Treatment Center has created inpatient treatment, and I believe they're the first facility of that kind to be in Whatcom County. Often people have to leave the area for inpatient treatment. I don't see more questions, but I have one. One question I have is, do people have to pay rent to stay at Recovery House?
No, so the Recovery House is a treatment facility, so it is funded through Medicaid, essentially, or through medical insurance, but it is Medicaid clientele. We are serving the low income under the 30% AMI. So essentially their fees will be covered through that.
Thanks. There are some more questions. Teresa is asking, how's drug court doing with the new drug laws? I don't know if there's anyone who could speak to that.
I don't think we can speak to that.
Joe has a question. If a person is disabled and not able to return to work, could they still qualify for this program?
Absolutely. Returning to work isn't a admission checklist thing. It's more about getting them on their feet, stable, to be able to go back in the community on their own. So obtaining employment isn't a requirement to finish the program or be admitted into the program.
Thanks. Check the chat one more time here. Okay, no more questions yet, although I have one. I've been hearing a lot more recently about trauma-informed design and was wondering in what ways that's been implemented for the recovery house.
Shannon, can you address that?
I'm thinking.
Yeah, no, it's okay. Well,
sorry.
And Shannon, it's okay. Shannon, Kayla, and I have come in towards the end of the design process, which is usually in the initial, period of development. So what we believe is that the partnership with Lifeline and the Opportunity Council was looking at creating a space that mirrored, so keeping some of the old architectural, the historic concepts of big old archways and open windows and open bright spaces to make it feel more like a residential home versus an institution. So maybe, Terry, I think playing into what you're discussing is that it's intended to have people have a greater sense of being and belonging versus I'm in a structured institutional environment.
That's exactly where I was going with that, Adrian. Thank you.
No worries.
And I can jump in there from a treatment perspective. As an agency, we continue to focus on trauma-informed advocacy throughout the agency and trying to ensure that the services that we're providing are not creating more trauma and are helping to address the trauma of individuals seeking services. So I can't speak from the design perspective, but I can speak from where we are as an agency in working with trauma-informed care.
Thank you. I'm going to give it a few seconds in case there's another question that crops up. Someone wants to unmute and ask or to put it in the chat. I'm happy to read those out.
I know one question we get on occasion is how to recovery house, what does that look like? Does it all come through drug court? And the answer to that is it doesn't all come through drug court. As Kayla mentioned, folks can use this as a step down from another treatment facility, but it's not a walk-in service. So individuals coming into services will need a referral from another provider or another agency.
That was on my list too. Thanks, Shannon. I don't see any more questions, but thank you so much for this presentation and your time. And this is a very valuable project that I'm looking forward to.
Well, thank you for inviting us.
Okay, back to our agenda. I have a brief update. We have some new members in the steering committee. Deborah Bruce and Becky Spithill are joining the steering committee. Deborah is filling the position for person with lived experience, which is a really challenging role to recruit for. So I'm especially excited to have that filled, but there is another opening. So still looking for someone who would like to participate in our steering and also, of course, in our coalition, because that voice and perspective is really important as we're designing our system and implementing our plan. Becky Spithill is going to fill the position to represent healthcare, being on the board of directors for Unitycare Northwest. There is a little update to the charter that is pending and approved by steering, and that's that we had some challenges last meeting in meeting our quorum and discovered that our criteria was too strict. So prior, the criteria was a minimum of 13 members of steering to have a quorum to make a decision to move forward. We fortunately eventually got there, and then when we had quorum, we decided that is too stringent, and that's going to be changed to redefine it to consist of a majority of filled positions. Any questions about that? Discussion? No? Okay.
Terry, sorry to interrupt really quick. There are some calls that have come through on my end through outreach asking how to get on the steering committee. So I don't know if you can briefly speak to that just in an open setting.
Yeah, definitely. The steering committee is typically someone is nominated and they're interested in participating, then the steering committee will vote on whether that person should be added. And there's a structure for steering, so certain people are automatically added to it. So like city and county and service center representatives are in there, but then there are other populations represented. And another population that there's two that spring to mind that have openings in addition to that person with lived experience. One is someone to represent the Native American perspective, and another is someone from the business community. So the people that join usually meet that role in some fashion. And then as people, move jobs or leave, then we make announcements about what's open and accept nominations for the steering committee. Can anyone nominate someone for the steering committee? Yes. Short answer, yes. Any other questions? Okay. Little bit of time left here. I think that will make it. Samia, could you do an update from the city?
I'd be happy to. Thanks, Terry.
Thank you.
Samantha Lutz, work with the City of Bellingham in the Housing and Services Division under Community Development. And great to see folks here. Thank you for those presentations. A couple things I wanted to mention. One is excited to welcome a new staff member to our team. Katie Sullivan has been hired, and I'm going to give her a chance to introduce herself before I continue with my updates.
Thank you, Samia. Hi, everyone. Thank you for having us here this afternoon. As Samia just mentioned, I am a new employee with the City of Bellingham. I will be working as a development specialist with the city. I wanted to take a moment just to introduce myself to the group and also see if there's any interest from anyone here in connecting. A little bit more about myself. I have a background in affordable housing development and policy analysis. I have a bit more of a gap on the case management side, and this group is obviously such a great brain trust on that front. So if it's all right, I think I'm going to drop my info in the chat, and if anyone wants to connect, please feel free to reach out, but very excited to be working with this group. And thanks again for having us.
And Katie's really going to focus on the city's role in addressing homelessness and housing, supporting our housing development side as well. So you'll be seeing her face probably more than mine in the future at these meetings going forward. So we're thrilled to have her. I also am going to drop something in the chat during the way station discussion. The homeless strategies work group recommendations were mentioned, and I just wanted to let everyone know that those were discussed recently with the Bellingham City Council. And I put the link in the chat if folks are interested in seeing the meeting where those recommendations were presented. and what the Bellingham City Council members' discussion looked like around those recommendations. There are quite a few in there, a number of which are on our immediate kind of to-do list moving forward in collaboration with county staff and other partners in the community to kind of try and move forward and get more solutions on the ground for folks. And then lastly, I just wanted to mention also at a city council meeting, the last one in April, the council recommended to move forward with our annual action plan, which contains all the priorities for the next year, which for us is July 1st through June 30th. And this action plan was really unprecedented in the amount of kind of different funding sources that were coming forward for the city, including over about $9 million in funding from the Federal Department of Housing and Urban Development, and then city sources as well, including the housing levy and the new sales tax that was approved, which is referred to as 1590 funds, which will start coming in probably in about September and will generate about $3 million a year to help with addressing housing and services needs in our community. So I'll pause if there's any questions. Otherwise, thanks for having me.
Thanks, Samia. I don't see any questions so far in the chat, but I'll give it a few seconds here. Thank you, Samia, and welcome, Katie. Looking forward to working with you. Barbara, can you do the update for the county, please?
I can, thank you.
Thanks.
Hi, for those of you that don't know me, my name is Barbara Johnson-Vinna, as it states, and I work for the county along with my co-worker, Chris D'Onofrio, who is here today. Both Chris and I work as housing specialists for the Whatcom County Health Department, and we work very closely with the city of Bellingham to make sure that we're coordinating our efforts around homelessness and affordable housing throughout the county and city of Bellingham. So just a few more comments to add to Samia's about the Homeless Strategies Work Group. I just wanted to let people know that their last meeting was on April 16th, and their members approved of short and long-term recommendations related to shelter needs, which were provided both to the city of Bellingham and the county council. So at the subsequent county council meeting, they reviewed and received some final recommendations and asked that another committee, which is the Whatcom County Housing Advisory Committee, if they would assume responsibility for moving the recommendations forward proposed by the Homeless Strategies Work Group. So I think this is a good fit, as it is the role of the housing advisory, the county, of funding affordable housing and supportive housing, as well as providing guidance on our local plan to end homelessness and collaboration with partners in meeting the objectives and goals of our local strategic plan to address and end homelessness in Whatcom County. So the membership of that committee includes a diverse range of local partners with expertise and knowledge about affordable housing and homelessness, along with 2 positions for City of Bellingham staff. So as I said, the recommendations for consideration offered by the Homeless Strategies Work Group relate to the need for expansion in a variety of different shelter types and for various subpopulations. So among them was the recommendation to provide motel stays for families with children. And I thought it was important for the coalition to be aware of the fact that the city and county are working very closely together. We've been meeting weekly, and this has largely been on the forefront of our agenda to address the need for emergency shelter for families with children. So we've spent really a substantial amount of funding for that purpose over the past 6 months and even prior to that. So with the significant increase in need in this area, we really need to work on solidifying our plans for the coming year. And we're working closely with the city to do so. So moving on from that, I think the other thing I wanted to talk about was just the big news from this legislative season. There was a lot of wins for homelessness and for affordable housing. I've never seen anything like it in the 6 years I've been on staff here. You know, among them, 350 million in the capital budget was offered or was added, and that is to build and preserve affordable homes, including 175 million for the Housing Trust Fund. We have 650 million more for rental assistance, 187 million for foreclosure prevention, 72 million for shelter and housing for people experiencing homelessness, 27 million added to the Housing and Essential Needs Program, and that's the HEN program, which we already get a pretty substantial grant from Commerce every other year that serves primarily singles and people that have disabilities. So that particular funding source, I think, is really important in consideration of the fact that, you know, so many of the people living out on in the rough, so to speak, are singles. So I'm really grateful that they added to that funding source. There's also $2 million for a transitional housing pilot for homeless youth, and 222 million of the state for COVID and federal appropriations for rental assistance. And that includes project-based vouchers for nonprofit housing providers, rapid rehousing, emergency housing, and foreclosure prevention. So that's just a piece of what was passed. It's just outstanding, and I'm just really grateful. And you know, there's still a lot more to be done, let's face it, but we've got a lot of work to do to implement these new resources locally, and it's just exciting. So that's all I have. If anyone has any questions, you can put it in the chat box, or I'll put my email address in the chat box, and you're welcome to email me as well.
Thanks, Barbara.
You're welcome.
I want to mention the Washington Low Income Housing Alliance here because their advocacy is really instrumental in moving all those efforts forward. And this group had a role to play there as well. Folks who join the mailing list for the coalition will occasionally get emails from Jasmine from my office when there are opportunities for you to act and support bills to alleviate homelessness. And the other thing I think is really special that they do is they do a listening tour while they're advocating, and they met with us and just listened to concerns of the community and service providers and used that to inform their strategy. So that's very important. And then the last thing they do is assist in hosting Advocacy Day. I think it's every February. Typically, a bunch of advocates would just get in a van and drive down to Olympia and meet with electeds and talk about their priorities. This last year was different, obviously. It was done virtually, but we were still supported and participating in that. So those are some really good opportunity for advocacy through the coalition, aided by the Low Income Housing Alliance. Any questions for Barbara? I guess I should say too, if you want to find out about those advocacy efforts, you can put your email in the chat still. We'll add you to the mailing list, or you can just look them up online and get on their mailing list. We have 7 minutes left for any announcements, program changes, public comments, and I see Dina has already made a comment, so I'm going to read that. And it would be good if it could be clarified that the Homeless Strategies Work Group was not aware that the recommendations they forwarded to the county were their final recommendations. They were only final because the Homeless Strategies Work Group was disbanded by way of a resolution that the county council voted to approve on May 4th that concluded the work of the Homeless Strategies Work Group. At least some Homeless Strategies Work Group members were not aware that the Homeless Strategies Work Group was going to be disbanded. And thanks, Dina, we will add you to the mailing list. And then Heather K requests that we read any chat comments, so I just did that. And since there are people on the phone, if you want the website for the Low Income Housing Alliance, Chris put it in the chat, so I will read that. It's www.wliha.org.
Terry,
anything else to share?
Yeah, Terry, it's Adrian. I've got an additional topic I want to add real quick here. Since I didn't see it on the agenda this month, June is Pride Month, and I know that the Homeless Coalition previously recognized that. And since it wasn't on here this year, I wanted, as a service provider who's also gay and transgender and who's experienced 15 years of homelessness and housing instability in Whatcom County, to make sure it got mentioned and acknowledged. And also just wanted to mention a quick couple statistics related to homelessness in the LGBTQ community for everyone to keep in mind while we're engaging with individuals in our work who might be impacted. So something that comes up is regarding youth. As much as 40% of homeless youth in the United States identify as LGBTQ, 40%. I want to acknowledge the work that Northwest Youth Services does to help that population. And then coming in on the heels of that, there are new statistics as of last year that came out. I'll be putting the sources in the chat here regarding this. As far as adults go, gay, lesbian, and bisexual adults are 2 times as likely to experience homelessness as non-gay, lesbian, and bisexual adults. And the majority of them are experiencing homelessness for the first time as adults. So that means there's a large demographic that are missing services if they are not youth aged. And additionally, transgender and non-binary people report even higher percentages than that. And people of color are disproportionately affected within the LGBTQ population. So just really wanted to make sure that we're all keeping that in mind, all the time, but especially this month more than ever. Thank you.
Hey, Adrian, I'm really thankful that you made that announcement and shared that information. Appreciate that. There's a few more comments in chat, and I'm sorry I keep leaning forward because the chat is tiny and my eyes are old. Okay, this comment is from Sandy Robson. Last month when I called, the 360-255-2091 phone number provided online for people wanting more information about the Coalition to End Homelessness, I heard the following voice greeting message. Hello, of the Opportunity Council. If you are 18 years or older and in need of immediate shelter, please contact the Lighthouse Mission Ministries at 360-733-5120 extension 0, or visit the drop-in center currently located at Bellingham High School, 2020 Cornwall Avenue. For the homeless outreach team, please call 360-312-3717. So people calling the 360-255-2091 number who hears that message greeting may think the drop-in center currently located at the Bellingham High School, but the drop-in center moved back in July 2020 from that location to its new site called Base Camp, located at 1530 Cornwall Avenue. As of today's date, the message greeting stating the incorrect current location for the drop-in center is still contained in that voice greeting. I appreciate that. Thank you. I remember speaking with you when you called, and that's when I gave you the information to connect with us here today. We at Opportunity Council are in the middle of a telephone system change, which has had a lot of ups and downs. So that will be addressed. I want to assure you of that. Oh, and Jasmine mentioned that. Jasmine says, hi, Sandy, our phone system is changing to a new one within a matter of days. What was supposed to be today, but is delayed, so that will be fixed soon. And Indy says, happy Pride. And Sandy says, sorry, but this last part of cutoff of my message, my previous chat message, as of today's date, the message greeting stating the current location of the drop-in center is still contained in that voice greeting message. Can someone at the Opportunity Council please get that greeting message changed so that it will provide to callers the correct location for the drop-in center? Thank you. Yes, when our telephone system is changed, which was supposed to happen today, that will be fixed. Marisa says, this will be fixed, and thank you for the heads up. And then more thanks to Adrian from Rachel and Barbara. And some sources in the chat from Hadrian. I'm going to read it out in case you want to, you're on the phone, which is https://youth.gov/youth-topic/youth-youth/homelessness. And the other website is the UCLA School of Law, and that's at williamsinstitute.law.ucla.edu/publications/LGBT-homelessness-US. And the comment from Aaron Delegati saying that the phone lines for rental assistance do not seem to be working, nor does the online form for your information. I can speak to that a little bit. And it is connected to our phone system, but it's also connected to the demand. So every single month for the last 5 months, the overwhelming demand for rental assistance has crashed our system. And we've had to be very nimble in putting those resources back together. If that's still an issue right now, I'm going to give you my extension to call so that we can make sure that you're connected, although the appointments fill up very quickly for the month. So there's no guarantee of that. But my phone number is 360-255-2091 and my extension is 132. So if you are needing rental assistance and not able to get through, give me a call and I'll get to the bottom of it. Anything else before we adjourn today? Thanks everybody for being here. I was really excited to see such good attendance and want to remind you that our next meeting is August 5th. Same Zoom, 3:30 to 5 on a Thursday.